Welcome to the Pathways to Prosperity podcast, where we explore personal, professional, and financial success stories of top achievers. Let's dive in.
Welcome to Pathway to Prosperity for Entrepreneurs. My name is Tristan. I am the co-host with Terrence here, where we also dive in and delve into stories of innovators who change the game for their fields. Today, we're excited to introduce Aaron Captain Little, CEO of Per Diem Therapy Experts, a leader transforming healthcare staffing through technology, with a rich background with the Marine Corps to JP Morgan Chase, and now revolutionizing the Per Diem Therapy staffing. Aaron brings strategic insights and operational expertise to tackling the complexities of healthcare. Tune in as we explore how his company leverages app-based solutions to ensure top-tier patient care while simplifying the staffing process for healthcare facilities. So, how you doing, Aaron? How you been?
I'm doing great. Thanks so much for having me on the show today, Tristan. Appreciate it.
Of course. So, we talk about per diem staffing. So, can you possibly give us like a quick snapshot of what the company is?
Sure. So this healthcare has all this Latin in it, and per diem is just for day by day. And
Mhm.
so with healthcare, I think that you're never going to eliminate the need for a labor force that's available. As people get sick, people get healthy. The staffing dynamics are fluid, and there's always that potential of needing extra help and extra staff. So now with per diem therapy experts, we're just simply being able to provide that staff through technology and app-based scheduling.
So I know being healthcare for myself and just kind of having that transition. So how hard is it to have that contract with companies, or how does that per diem work with other facilities and wherever you're located?
Sure. So, it's really an Uber-like model where we talk to facilities and say, hey, if you ever need any extra help, just go on our app and only pay for what you use. Oh, that's simple. That's a good plan. When you think about if you get a flat tire, you have a couple options. You can go to Enterprise or wherever and rent a car until, that tire gets fixed, and that might take a week or whatever. But if you just need to go to the airport and you're in a rush, you say, you know what, let me just Uber to the airport and knock out my business and do what I have to do, and then you can get your spare tire put on when you have free time, and then you can go get a
Mhm.
tire changed. But my point that I'm trying to make is that it depends on your situation of what you need. And so with staffing in healthcare, you need full-time people. Absolutely. You want to have a
Right.
full-time staff. You might need some part-time people. That's a great too. Then you might need some travelers mixed in there. But I'm saying as part of your staffing program, per diem has to be part of that makeup, because you just never know when you have a call out, a cancellation, someone's sick, someone has COVID, and they're out for 2 weeks or a week or whatever the case may be. This is a solution that can help bridge that gap in real time.
So there's a lot of competition in per diem staffing. I mean, I know there's a lot of companies, and I know there's a lot of just, big challenges. Like, what do you feel like that your company does that's a lot better? And how do you tackle the challenges related to that?
Sure. So I think we hyper focus on therapy, and that makes us the Chipotle of therapy, right?
Okay.
And Chipotle starts serving French fries, I'll never go back.
Yeah.
That's not what they do, right? That's not
Yeah.
their expertise. So we know our expertise. We staff 5 disciplines: PTs, physical therapy assistants, OTs, CODAs, and speech therapists. That's it. And my partner, Saritha, she's a doctor of physical therapy. She's been in the industry for over 15 years. And so she
Okay.
brings that clinical expertise to our team. I bring some of the technology background. And because she's Indian, we're going to have a team in Chennai, India. I'm going to get a beach condo out there.
Oh,
And
wow.
we're going to make sure that we train our back office team to help support our clinicians and our clients. What that does is it helps me manage my costs. We're still gonna have US employees and US
Right.
recruiters as well, but when you see the future of the workforce, remote work, technology, being able to do these kinds of things, there's a lot of fantastic people in India, and I've interviewed with them every other day. So when you have that whole continuum of expertise in the industry, an efficient operation that maximizes the cost, I can pass those savings back, and I get the operational efficiency of the technology. And now I'm piloting and I'm going to be using an AI recruitment tool as well. All these things reduce my cost. If I can reduce
Right.
my cost, I can pay the clinicians more, I can bill my clients a little bit less, and have a beautiful business and a profit margin in there. And then again, we specialize. So when you do all those things and put it all together, we're going to be Chipotle, we're going to be Chick-fil-A, we're going to have that customer service experience, but with high excellence on execution. And then the ability to scale across the country and have this offer in every major metro over 1 million people. And then it just farms out from there. This will be the Uber of therapists. And so that's the vision, that's the game plan. And because I happen to have done the same exact thing at Gale Healthcare Solutions, I feel pretty confident.
So how long have you been in the per diem and healthcare space altogether, would you say?
Sure, it's coming up on 8 years here. So, and that's a long time because healthcare staffing, and I joke about this, is 24/7, right? So
Right.
it's really like double the time.
Yeah, no, it really, yeah.
And when we launched the Gale app in 2016, no one was doing this. This
Mhm.
is revolutionary. We were trailblazers. You're telling me you're gonna click a button on an app and some nurse is gonna show up? And we're like, yes, yes, indeed, staffing coordinator,
Yeah.
it's gonna show up. And sure enough, they showed up. And so that was in 2016. Now fast forward, we're in 2024 going into 25. We're talking about AI recruiters, AI chat agents, AI everything. I've been doing this for 8 years, and so I've seen all these different evolutions, and now I believe that I understand the balance. You need to have technology, of course, we want
Right.
technology, but with healthcare, you still wanna have that personal touch available to clinicians that want it, and you wanna span all those different customer types. You've got the baby boomers that are still in the workforce, you've got the
Right.
millennials and Gen Zs that don't wanna talk to anyone, and they just wanna
Mhm.
go do, 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 do. So I wanna be able to service all of them with whatever technology I build.
Right, yeah, sounds like sounds like you've been, the trial and error of 8 years have been not only great for you, that also, like, you're learning from it, and that's the thing that a lot of companies need to do. They need to learn how they're able to tailor make and use the technology, and that's what you have your background in. And also you have the therapy in the background.
Absolutely, and that's when you talk to your clients and you hear
Mhm.
their pain points, that's when real entrepreneurs can say, "Oh, there's a problem, I can fix that and run a business and make a profit." That's all we do. This is a very simple offer. So right now, Per Diem Therapy Experts, we're gonna own the space from 3 hours up to 2 weeks and everything in between that.
Oh, wow,
And
okay.
no one touches that space because it's too hard, it's too
Mhm.
much back and forth. I just credentialed someone. I want them to work 13 weeks for me before I even, get out of bed,
Yeah.
is what most companies will say.
Yeah.
It's too much work. Well, I've got a digital application process. I've got an offshore credentialing team, and then I've got a digital recruiter process. And so it's the same level of work for me if I'm doing a 13-week contract or a per diem contract because now I can automate so much of it. So I love per diem. Let's do per diem all day long. I like the fast pace of it because remember at the end of this is a patient. We need to
Mhm.
get some person to show up for a shift because some patient or resident needs care. They need to
Right.
get they need to get their stretching done, they need to get their exercises done. And so that's why I feel very passionate that we get to help people and run a business and make a profit, take care of our families, but of course, provide great patient care. So that's why I just love the staffing industry because it's a necessary monster because healthcare is so big and the dynamics are and the needs change so much. You have to have these solutions available.
So when we talk about healthcare and per diem, so I've seen a lot of shifts in for nurses not even wanting to be, or healthcare professionals not even wanting to be full time. Do you see an increase or influx with that with the therapy side also? Do you see that there's a lot more of that wanting to have that life to themselves?
Sure. I think we're gonna see more as we scale across the country because
Mhm.
therapists need to know this offer exists, and that's where we're gonna spend a lot of money, a lot of
Right.
lot of energy to let everyone know, "Hey, guys, you don't have to be full-time only." And actually, the pitch is really this. We've got stay-at-home moms, we've got stay-at-home dads, we got people going back to get their doctorate or get their
Mhm.
master's. They need flexibility. They need to be able to work. Hey, like, Aaron, I want to work 20 hours. Can you help me? Yes, come on.
Yeah.
Let's find you some shifts. Let's find you some hours that you can work and make that ideal scheduling tool. Oh, I might want to make that a feature. That sounds like a good feature. We're
There you
gonna
go.
we're gonna make that process for them in the technology so they can build their ideal scheduler and they can work 20 hours and they know how much they're gonna earn for that week
Mhm.
and life is beautiful. And on the flip side, we might have clinicians that are working full time, But hey, inflation, cost of everything's going up, gas, electricity bills, utility bills, and someone else wants to work an extra 8 hours on Saturday. Come on, let's go. And so that's a beautiful situation for both the clinician and the client, because the client says, ah, that traveler is not going to start for another week. I need,
Yeah.
I need help this week. Help me. Yes, I can. It might be three people, but I can give you Susie
Right.
on Monday for 3 hours, Sally on Tuesday for 4 hours, and Betty
Mhm.
on Saturday for another 8 hours. So when you put that together, it's actually what the client wants, but no one's offering it today. No one's offering it. So that's why I'm jumping up and down saying we can do it now very easily with technology. And that's where I'm excited about, where the future is for 2025.
So, what do you see the biggest challenges will be either in the coming years, or what has been a big challenge the starting of this business?
Whenever you start anything new, you have a chance to see, okay, uh, do the people adopt? Do the clinicians
Mm.
adopt the technology? Do the clients adopt the technology? Sometimes healthcare can be a little bit slow to adopt
Right.
new innovations. I think it was a big deal. A lot of nurses quit, I was told, when electronic medical records started. They're like, I'm not going on a
Yeah.
computer to log and chart. Like, well, but it's better for the patient,
Mhm.
we want to still do everything carbon copy. And so this is a natural evolution of staffing, I believe. And right now we've got great feedback from the clinicians. They get it now. When I started at Gale in 2016, I had to explain to people how to go to the app store, how to set up an Apple ID, how to download
Mhm.
an app. It was that intense of getting people on the platform. Now today it's like, oh, we have an app. Okay, yeah, great. Text me the link.
They're
Boom.
like, yeah.
So on the clinician side, there's more adoption. On the client side, as they see this offer coming up, so they're saying, wait, so I can just request someone for 3 hours? Yes, you can. And everyone's happy with that? Yes. How much does it cost? You just pay for what you use. Okay, let's try it. And so
Yeah.
so it's like having those meetings one at a time across the whole country, which I'm fine to do. It'll take us 5 years, but that's the plan. So, we're gonna scale. We started in Los Angeles, California. We've got other
Oh,
clients in Northern California, so we're booking hours today. I live in Tampa, so we're gonna be launching Tampa here in the first quarter. And then Tampa, you get that Orlando sprawl a little bit. So let's launch Orlando. My brother's up in Jacksonville. Let's launch Jacksonville. So this is not a complicated offer because I want people to refer their friends, tell everyone about it, and then that'll save me a little bit of money on Indeed.
yeah, right.
But that word
Yeah.
of mouth, we want to do a good job. We want to take care of our clinicians, and they should tell their friends and say, "Oh yeah, we love working with PDTX," and they sign up and get onboarded in a couple days, and they're picking up shifts right after that. So that's the model. It's very straightforward, but it's very necessary and needed right now.
Well, it sounds like that you're doing well with your business. California, I know there's a lot of regulations with their market out there, and I know it's pretty heavy with even buying a car. So I mean, opening up, building a business, I know it's gonna be night and day, but knowing how first it was in California, now you're going out to Florida. That's pretty much cross country. That's edge to edge.
Yeah, that
So,
is that.
what do you see? Like, what's the biggest difference that you're seeing in like getting the credentialing out there?
Sure. So, and you said it, California is a bear, but and I'm a Marine, so we just do hard things for
Right.
but we believe that it's too big of an economy to ignore. We
Mhm.
need to know the rules. We need to learn all the rules, and the rules do change. So we have consultants and people helping us navigate all those regulatory changes. But yeah, it's a lot more strict and it's a lot more expensive. And so, that's kind of the cost of doing business out there. But we want to do business, and then
Right.
also too, we understand mentally if we get California where we want it to be, everywhere else is easy. Everywhere
True.
else is
Yeah.
downhill. So it's like, oh, we get California producing, getting 1,000 clinicians working every week out there. Everything else is, oh, this is easy
It's
state.
easy. Yeah, yeah.
So that's kind of the mentality. It's like, let's go do the hard thing. And this also proves the model. We're doing it all virtually. So that means we're able to onboard clinicians virtually in California and send them to work and get them paid same day, by the way, which is also hard in
Oh,
California.
okay.
And so now that's the benefit, right? So when you finish your hours for that day, I GPS track you, you clocked in, clocked out in the client system, we confirm everything, and within about 5 or 10 minutes, you're paid. That's a huge benefit for these clinicians where you're working extra. Let's pay you right now, like right
Right.
now. And if you do that, that's where we just think this is a great offer for clinicians, a great offer for the therapy settings that our clinicians can work in, and we believe it can scale and be a beautiful business over the years.
Wow. That's I love the mentality. I love that you're tackling it. You know, it's like you said, it's like a big bear, but like you said, you're in the Marines. So I mean it's not like you haven't tackled anything that's too out of reach, right?
Exactly, exactly.
So a lot of our viewers and guests on here also look for the future, not only for themselves, for the family, but also trying to understand how they're able to even enhance or even replace their income. Do you know of anything that you're thinking of doing to really enhance that side of yours? Like I know you have your per diem staffing, but are there other avenues you're looking for?
Sure. So I think there's a lot of things that entrepreneurs can do to supplement or double their income on the
Mhm.
side. I'm a big fan of the side hustle, and I'm a 5 a.m. person. I'm a midnight person sometimes too, and because that's what it takes. I had when I was coming up, and my very first really successful venture was a event planning company. I was a
Mhm.
logistics officer in the Marine Corps, and so I planned events. It was weddings and corporate events. And so the brides love the discipline, and they love the blue napkins. Let's do
Yeah, the nuances, right?
no charcuterie. Like I was decisive. They like that was calming and reassuring to them. Like we're on schedule. Let's go. That dress, these shoes. So
Yeah.
yeah, but hey, you know what? I could do that nights and weekends. I could do that nights and weekends, and I could plan the events, and I would go out my car at lunch and then my lunch hour. I'd have my iPad and I had a keyboard for it. I'd pop on all my emails for 45 minutes, head back in the office and keep it moving. And so I made like about 50 grand on the side doing that. So that's in
Wow.
addition to full-time work, and that's available to you now. We use that money to pay off debt. I should have sold that business. It was actually pretty good. My phone still rings occasionally from that company. But that my point is that you can use those funds to go get into another deal. So I
Mhm.
should have sold my company. I ended up just closing it because I was like, oh, I'm a small person, only five or six
Right.
accounts. But then you can take that money and leverage it into real estate is my next big thing. I want to buy a 40 unit apartment complex because real estate is not going away. We see it, at least in Tampa, you see it. The
Oh
cost of a
yeah.
starter home in Tampa is like $400,000. That's a lot of money in Florida. And
Mm.
so that means that apartments are still going to be very much necessary over the next 10, 15 years. So that you can diversify yourself. I'm a big Grant Cardone guy. You can get on part of his
Yeah.
syndication deals and invest with him, even with 5 grand. So you can be in the game with 5 grand, under someone else's JV. Excuse me. There's also the opportunity to buy businesses. Some people are
Mhm.
retiring. There's baby boomers that are retiring every day. If you have an industry that you're interested in, sometimes you only need 10% down. Sometimes the owner will finance it. Sometimes you can do an earn in where you say, I'll be sweat equity. Let me earn some equity in the company and give them a
Mhm.
3-year transition plan. And some people, they made a lot of money over the years and they're like, well, pay me a salary and you take it over. Oh, okay, sure.
Like, yeah, yeah, yeah. Like,
Yeah.
right. I mean, yeah.
But you have to be in the game asking these questions, meeting people,
Mhm.
doing meetings, and analyzing deals, understand the financials, and read. You can get a library card. Library card's free. And you can just be in the windshield university. So whenever you're driving, are you listening to tapes? Are you listening to business people, learning and growing in your car in that free time that you're just sitting there listening to music? Listen to audios, read books, read for an hour a day, read for 30 minutes a day, read 10 pages a day. But you have to be doing all these things if you truly want to move the needle from where you are today to where you want
Mhm.
to be. Get a game plan, find a mentor. And there's a lot of people now. I love social media because there's people you can get access to that are putting out a lot of free content. If you listen to it for 30 minutes, I love Eric Thomas, Grant Cardone, all these guys. You get Eric Thomas pumps you up. Grant Cardone, you like what you go do. And then you read
Yeah.
Dave Ramsey, make sure you got everything, tight with your budget. So you listen to all these people that have free content. There's no excuse today. There's no excuse in 2025 not to be able to work towards your goals.
Yeah, I feel like that. I mean, it's just like how when Vine came out, right? Vine was 30 seconds long. We're like, oh, that's too long. Or that's perfect. Now it's like TikTok has like 10, 15 seconds. I feel like a lot of people are looking at that the quick business or like the quick get rich things, and the things that make them rich. And they see all this other social media influence. They don't want to do like the hard grind. Or I mean, there are some people who have that that 1 in a million chance where they do make money off of like the one thing that they do. So it's really hard.
It can be hard, but I think people are fooling themselves to say, I watched a 15-second Grant Cardone, and now I'm not a millionaire, and Grant Cardone's horrible. No, in
Right.
the library, I've listened to 3 Grant Cardone books in the last month. Okay,
Mhm.
that's why I'm talking about buying 40 units. I want to figure out how to go buy 40 units. I've done
Mhm.
some smaller deals with like just single family, but it's like I had a bad tenant. They messed the toilet. I had another tenant that didn't pay rent. I had to evict someone. But Grant, the thing that he said that got me was scale. If you buy 40 buildings, you've scaled now and you de-risked yourself. I'm like, oh, that makes sense. If you have one bad tenant, you're not out of business. You have one
Right.
bad tenant in single family, like I got to cover the mortgage for 3 months to get somebody in there, and I got to pay 5 grand to replace the carpet or whatever else they did. So that's
Yeah.
where okay, I'm gonna go start looking for deals in Tampa and Jacksonville that
Mhm.
are, $1 million or $2 million, and I can go get 10 friends that all have 100 grand, and then we can go buy an apartment. So I think that's where you have to be in the game. You have to be talking and letting everyone know what your goals are, what are you working towards. And that's the way that you can kind of, and all of a sudden you ask people, do you know anyone that's looking to get into multifamily real estate investing? Oh, well, actually, my uncle, he does a bunch.
Yeah.
Oh, can I meet with them? Can I buy them coffee? And you
Mhm.
have a coffee budget, have $100 coffee budget, and go do these meetings and buy people coffee and learn and absorb and be a sponge and then
Mhm.
execute on something. My biggest thing that I'm actually really good at is trying. I've struck out a lot. I can't tell you all the businesses that I've failed on, but
Mhm.
I take a lot of swings. But every time I learn, you learn and learn and learn and say, okay, now don't learn a lesson twice. That's very expensive. Learn the
Right.
lesson once, get those learnings from it, and then you can apply them in future deals. That's why I'm excited right now because I've already done a healthcare staffing app-based startup and I know what worked and I know what didn't work. I just need to go do all the things
Yeah.
that avoid the things that work, and we're going to be successful again.
Well, that's the thing is like you, like you said, if you keep making mistakes and they're not lessons, right? They're always gonna be mistakes, and once you have that the mentality of being able to really overcome and learn from them, you're able to really scale. I feel like that everyone's like the hardest thing is making your first million. After that, the second is easier. It's easier to make another million from another business because you'll understand what the nuances are. You understand that this is what you don't need. You need to actually do this with your company instead of X, Y, Z. So it's really good that you're learning from that aspect and you're really putting your best foot forward and not just saying, oh, maybe it was just that time. But you're saying, hey,
Yeah.
like I don't need to make that again. So
Yeah. So I remember when I was starting out at Gale, my job was sales. I was started out basically as like a salesperson, and I
mhm.
had to make 1,800. Sorry. For 18 months, I made 100 calls a day. That sounds like a crazy number, but that's what I did. And I can
Yeah.
show you, I keep pennies everywhere I go. This is like off, but because I would move pennies. So I've got my pennies here to move them from this side of the tray to this side of the tray to log all my calls. And every day you do 100 calls. That's what it
Wow.
takes to be successful, is to do that hard thing. I was doing cold calls before I got on the phone with you. They're just different now. Now I'm asking people, hey, I see you've been in business for 17 years. You ever consider selling? And they're like,
Yeah.
oh, no one's ever asked. Let's have a meeting.
Yeah.
So it's hard. Or when I'm
Mhm.
fundraising, hey, I'm looking for $1.5 million to scale my therapy startup. Are you interested in investing? Oh, tell me more. Like, so
Mhm.
you have to have those skills, but the process of 18 months moving pennies back and forth from my desk to this other side of the desk, we generated over $5 million in revenue. Oh,
Yeah.
well, now I know how to be successful. So once you understand that how to be successful, now it's easy. Now it's rinse and repeat. You got to make your script, you got to do your thing, whatever it applies to. But it's the process of going from zero to that first big win. Once you learn those steps, now you got it. Even Thomas Edison, okay, I know 10,000 steps to make the light bulb. Well, it took 10,000 steps, but now he can do it much faster if he wanted to make,
Exactly.
a brighter light bulb, right? Only 2 steps or 10 steps. But the point being is that you got to take steps. You got to take every single
Yeah.
incremental step, learn those lessons, do it the first time. And yeah, now I got to go do it again. I've got to go do it again. And we'll see what happens 3 years from now, 5 years from now, how big this company is. But then I'll probably want to do something else. So, and grow.
Well, well, I mean, honestly, like you said, it's taking those steps and being consistent. I think that a lot of people, I think it's like the newer age. And I'm in it too. It's just consistency. Like they're like, oh, it's not. I'm like you said, I'm striking out 100 times and then I'm going nowhere. But what if that one more time you actually make a home run? So
Yep.
that's the difference between like a major league baseball player and like a triple A. I mean, one knows that hey, even though I struck out this last 2 times, stats say that I'm gonna make a home run. I'm gonna get on base and I'm gonna be able to make sure my team is going forward.
I love baseball for all the analogies because it's a long season and it's a
Hmm.
grueling season and
Yeah.
you're there and then all of a sudden you have three chances to swing the bat. Three. And if
Hmm.
you get hit, just to base it a single, one time, you're batting 333. If you do that consistently for
Hmm.
your whole career, you're in the Hall of Fame. Oh my gosh. Not even a home run. Not
No.
even
Yeah.
runs back. Just be consistent. And so that's where the military helped me in that. And it's like,
Hmm.
oh, you have to be disciplined. You have to be consistent. So now I make a daily schedule. I make a weekly schedule. I make my weekly goals. I make my monthly goals. You do all those little things. And I had a mentor tell me that, Aaron, you're going to make 98 calls and you're going to get two people on the phone. And it's the last two that you smile bigger. And once I understood that, so the first 10 calls, I'm smiling, but it's like, okay, I'm excited to get to 50 and 60 because once you get
Yeah.
over, you're getting closer to the two people that you're going to connect with. And of course, you connect with people before that, but it's the discipline of knowing I've got to make 100 to get two.
Yeah.
2% success for my deals is fantastic because every deal is worth whatever it's worth. And now, if you do that consistently for 18 months, it's going to the gym, everything. You can't go to the gym one time for 2 hours and
And the
say,
thing.
you gotta go, you gotta go every day for
Yeah.
30 minutes every day, and watch what you eat, what time you go to bed, all the other stuff. But if you do that 30 minutes a day for 2 years, oh my gosh, now make it an hour a day. Oh my gosh. That's the results. That's what we're talking about in business. It's the same thing. It's what you get at what you put into it. So if you're doing all the things I just said to do
Mhm.
5 years from now, oh, Aaron, that's a long
Yeah.
time. The pandemic was 5 years ago. Think about that. That's
Yeah.
kind of crazy to me. So it's like,
Thinking about that,
well,
yeah.
in that whole time, you could have been doing more things, more
Mhm.
deals, and then 5 years from now, this is you're there, you know? And so that's my mentality now. As I get a little bit more gray hairs, it's like, okay, let's not just
No.
no more microwaves. Let's make the crock pot. And
Mm.
I'm developing a 5 to 7 year plan, of being, creating a big, huge company.
Yeah, it's like I want to say having a mentor and having someone who's really to help you guide helps a lot more than you just failing. So a lot of people don't have that wisdom, or like, they don't want to give up and say like they're not the smartest person in the room. So being able to really say, hey, I know someone who has done better, who is willing to help me out and really show me the path. And those are mitigated risks. I mean, at the end of the day, that they're telling you what to do, they're telling you the mentality that you're going to have to be successful versus you're out here teaching yourself. You're like, why am I keep failing? But the guy in the background of your coach is saying, hey, it takes a fail. And so some people don't understand that aspect. But once you understand that and grasp, it's like the grind is real. I mean, like you do 1,000 calls to get 20 yeses, like you're saying.
Yeah.
I mean,
Yeah.
what it
And
is.
and and mentorship is sometimes I think about it a couple of different ways. You can have virtual mentors. If you stop and listen to, I'll use Dave Ramsey as an example because I listen to him every day. This is back in 2009 and 10
Okay.
before like you could stream. I had really bad reception on Camp Pendleton. And so I would download the podcast and listen to the
Yeah.
podcast on my 30-minute drive in, 30-minute drive off base because
Mhm.
you couldn't get the radio. And listening to him as a virtual mentor, then I read his book, then I did his program. He should charge a lot more because I was able to pay off $115,000 in debt from his teaching, and my investment in was maybe $200. You understand?
Well,
So
yeah.
when you can have these virtual mentors for a couple $100 investment to be able to learn all their mistakes, and people put out good things, and read 3 books by people that you admire, and you're going to learn a lot about what their belief systems are. So you can get virtual mentors through books and tapes and
Mhm.
programs. You can get virtual mentors from LinkedIn, where one person asked me to help. They said, "Mr. Littles, I'm trying to get my MBA in healthcare. Can I connect with you once a month and you just maybe even give me a project to do?" I said, "Sure. Free
Yeah.
labor? Sure."
Like, why not? Yeah.
We met once a month for, like, 8 months, and then he did, like, a one-week project, and I helped him talk to people in my company, and then he got his MBA. And he said,
Wow.
"Thank you for helping me." I was like, "Sure." Like, it was 15 minutes of work for me 8 times a month. Sure, why not? And so I'm
Yeah.
not saying everyone will do that, but it's like, you have to ask. He asked me, I said, I can yeah, I can do 30-minute calls, sure, whatever." So there's people like that, and then, of course, your local network. Who do you know locally? What groups can you get involved with? Who can you network with? Who do you know in your network that can guide you? Again, and it may not be free. That's the only thing people get hung up on is like, I want everything to be free.
Nothing.
Okay. I said Dave's book is $20. You can go to the library, get it for free, but then buy it so you can mark it up when you made some money.
Mhm.
But
Exactly.
you gotta make a little bit of investment. Skip Netflix, skip TV, skip something to save $20 to go invest in yourself, and there'll be a return on that investment if you do what the books and the tapes say.
I mean, it's true. You got it. You have to reinvest. You have to really put that money back to where it's making you money. I mean, essentially, it might seem like a lot now, but I feel like that's the name of the game. You have to make sure you put, like you said, it's kind of like sweat equity in your own life.
Oh yeah. Yeah.
You
I'm
have to
gonna
put it in.
I'm budgeting like $30,000. No, sorry, it's more than that. I'm budgeting like $40,000 next year for training.
Mm.
Training. So not
Yeah.
on email marketing, everything. It's training me. I'm investing $40,000 in myself next year to get better at what I do. So I can be a better consultant, which will make me more money and help
Right.
my clients. I will buy a 40 unit apartment complex.
Like this is gonna yeah.
So I don't wanna make a mistake with that, so I wanna pay for some training to do that
Mhm.
well, and then I do wanna be more of a thought leader and a brand on LinkedIn, so I wanna pay for some social media stuff because social media is not going away. And if we don't take control of our social media image and presence, you'll get lost in the crowd. So I know I'm allocating $40,000 of my income is going to go towards investing that I believe I'll get a return in 2 to 3 years down the road. Does that make sense?
Oh
That's
yeah.
that's what I have
Yeah.
to go do. You know?
Yeah, and then it's also you're putting money towards real estate and yourself that's gonna not because it won't stay. You won't stagnate, right? I mean, there's a reason it's called an investment because then you're gonna make your return on it. So you can make
Right.
2 to 5x return easily within 1 year. So
Right.
this is how you really apply it.
Absolutely. Absolutely.
So as we're wrapping up the interview, and I've seen you're very excited about your company or anything like that. What does it look like about 6 to 12 months from now? Like, are there anything crazy happening or any crazy deals?
There's a couple of deals, so I love trying to buy companies, and right now in the healthcare ecosystem, there's been a lot of turmoil with the pandemic's over, and
Mhm.
so that decreased some of the for staffing, but that's where those that can do what I said with having the multiple channels, U.S. resources where needed and appropriate, offshore resources where needed and appropriate, and AI where appropriate. Those are the companies that will win. So I'm building it like that from the start, and then the ones that have not adopted that thought process, they're not going to be profitable. And
No.
so, unfortunately, I want to buy them. I want to buy them. I want to get them bolted onto our ecosystem, and then I want to scale. Because this is such a new concept, the number one goal is to dominate this industry in Los Angeles, California, and then we'll scale from there to San Diego, most likely, and then Northern California. And then, of course, if I can finish my fundraising round in February, which is what I think will happen, then we'll scale into Florida. And so we'll launch Florida, Tampa, Orlando, Jacksonville. And then from there, I'll take a day off and figure out my trip to India because I do want to go there. And then, the stigma sometimes with offshore resources, accent, culture, things like that. That's why I want to
Yeah.
go. I want to train. I
Yeah.
want to get everyone to smile when they talk. And now there's
Mhm.
there's Indian millennials. I love this. They're like Gen Zers or whatever in India. And so this is fantastic. There's a lot of
Yeah.
energy over there, a lot of people. So I'm just excited about it. I'm excited about this industry. I'm excited about the opportunities to help people make some jobs, make really good jobs in the US, make good jobs in other countries, and also leverage technology to the best way possible. So that's the future. I don't think it's one or the other. I think it's a little bit of a hybrid across all three segments. And we can circle back in a year and see how it all shaped up.
Well, there you go. I'm glad that you're really, really putting yourself, your best foot forward. I mean, being able to even go to India and, understanding the workforce behind you versus just saying, oh, hey, here's some money. I'm going to give you some money. But now you're being intimate, right? You got to be
Right.
intimate with your business people. You got to be intimate with the people who are helping you because they're essentially the ones who are helping you scale the business, and maybe they have a future to do something else and you're giving them the opportunity. I mean, I know
Absolutely.
India is going to, in my opinion, I feel like India is going to be one of the countries that's going to be the next 5 to 10 years is going to be one of the major powerhouses. I definitely see the land, and they're watching other countries around them. They're watching them. They're understanding. Oh, this is what they're having mistakes on. I do see a very big, robust economy coming out there.
Yeah, and I'll share one little thing just on the side. This is all Zoom, right? This is all
Right.
virtual stuff, and so now there's great Indian people that are going to be doing U.S. jobs.
Yeah.
So
Oh
U.S.
yeah.
workers need to continue to upskill and add more value, be able to manage social media, be able to have two screens and work diligently for an 8-hour workday and pay for yourself, and then bring more revenue to the company. If you can't do that, then you're gonna be the ones at risk. So everyone's scared about AI. Everyone should be real scared about like good Indian workers that can for a cheaper price and with
Yeah.
the same quality. So that's where, there's a lot of dynamics there. So yes, there's a lot of interesting things happening in the future.
Well, thank you very much for everything, Aaron. Thank you much for your time and sharing your insights and tips with us. If
Yeah.
you don't mind, like, how can people reach out to you? Like, look for you, look for your company.
Sure. So I'm very big on LinkedIn. That's my platform of choice.
Yeah.
So connect with me, follow me on LinkedIn. I try to share a lot of topics, content on leadership, growth, of course, therapy and staffing and technology. So multifaceted LinkedIn channel. So I post a lot.
Yeah.
And then Per Diem Therapy Experts, PDTX.care, PDTX.care. If you need help getting staff, if you're a rehab company, or if you're a therapist and you want to learn more, feel free to connect with us, download our app, and we can get you on board and help you pick up some shifts.
All right. Well, thank you very much for having and staying with us. Hope everything goes well for you, especially scaling from California all the way out to Florida, and then also just going out to India and having an actual vacation for for a while.
Yeah, it's fun. It's fun. If you're how's the saying go? If you enjoy what you do, you don't work a day in your life. So I enjoy what
Yeah.
I do. So that's the benefit.
Well, there you go. Well, thank you very much, man. I hope you have a great day and hope to see you grow and keep doing more as you can.
Thanks. Same to you.
Cool.
Thanks for listening to the Pathways to Prosperity podcast. Got a success story to share? Visit pathwaystoprosperitypodcast.com/guest and apply today.